Hi, my name is Dr. Phil Memoli. This is a continuing part in a series on dental health, and today I'm going to discuss periodontal disease in the context of it being leaky gut of the mouth. So most people don't conceptualize it in this way, but I'm going to explain in this video how it's essentially leaky gut. Okay, let's look at leaky gut first. Leaky gut, as most of you probably know, is a malabsorption issue. And it's malabsorption from the perspective that under normal conditions, the gut cells prevent non-nutrients from entering the body. Okay? Technically what happens is, under the conditions of maybe poor diet, sensitivity to certain chemicals that might be in the environment and the food, people's gut cells break down, and instead of preventing non-food from coming into the body, now large food particles that normally would be excreted and non-food elements come into the body. And when they come into the body, they can cause a variety of reactions in people which can make them sick, including gluten sensitivity, immune reactions such as autoimmune, food allergies, and these things can cause disruption of patients' lives. In the same context, periodontal disease, okay, it has the same thing. Under our gums, there is an area like sulcus. Okay, there's an area like under our fingernails that there's a little pocket, and then at the base of that pocket there's an attachment, and that attachment prevents stuff from our mouth going directly into our body, so it's sealed off from the environment. Well, under conditions in which people take good care of their mouth, and by brushing, flossing, and getting regular cleanings and the like, and people eat good nutrient-dense foods, that attachment holds up very well. But in the absence of those things, that attachment can start breaking down. The beginning of that breakdown is inflammation in the mouth, which even people who are flossing, you can see that there's inflammation in the gums. All right? And if that progresses to the next step, an actual infection, a gum disease infection can develop. And when the gum disease infection develops, this attachment or this seal starts to break down. And when that seal starts to break down, the dentist with his probe doing a periodontal charting, when the normal numbers of 1 and 3 are exceeded, where you get like maybe 4 or 5 or greater, now what we have is we have a situation where that attachment or that seal, like where we have in the gut, this gum seal is now broken. And when that gum seal is broken, that means that bacteria living in the gums, the bacterial toxins that these bacteria release, and maybe even immune products that our immune system is going after this, which would normally be contained, all of this now enters the person's bloodstream, okay? And it gains access to some of our organs. And this shouldn't be in our bloodstream. And when it gets in the bloodstream, it causes a reaction. And we have documented these reactions. There's reactions where actual heart attacks can be doubled in people who are susceptible to this. There's also pulmonary problems where there's an increase in pneumonia. There's also problems with the pancreas, especially in the form of diabetes, where we notice that people who have this leaky gut of the mouth, okay, where they also have a exacerbation of their diabetes. And when people have the exacerbation of the diabetes, it worsens the leaky gut of the mouth. There's also situations of these bacterial toxins or the bacteria going to the uterus in women who are pregnant. And with the result that some babies can be born with underweight, okay, which causes diseases, which causes problems with development later in life, and also preterm birth, where the child's born before it's supposed to be born. The other issue is that while this is happening, we're actually getting the bone loss around the teeth, which is the primary focus of what most dentists are looking at. So we really need to look at, in conclusion here, we really need to look at these two aspects of the periodontal disease. We need to look at the leaky gut phenomenon of the mouth and the systemic consequences of that, and we also need to look at the bone loss that's occurring. So, in retrospect and in conclusion here, we could say that how does one diagnose, how does one treat these things? And that will be the subject of another series. But what I can say is that these are things that can be assessed with a simple periodontal exam. All right, and then since each person is different, it's very hard to characterize that this treatment will work for everybody. So thank you for tuning in. I welcome people's feedback on this, and thank you for tuning in, and we welcome any comments that you have. And thank you again for tuning in. Good night.